So we've got a pandemic survival action plan, and you might think, how detailed can an action plan like this get in a TED Talk style 15 to 20 minute time period? So what you're going to see is we're going to concentrate on one particular area that I think is most important while reviewing things that we all know from our experience living through and in this pandemic as it continues. So I'll start by saying at the onset of this, we had a basic premise we were operating in, and we've seen things evolve substantially as knowledge of this novel coronavirus has grown in terms of how it spreads, its virulency. We now have tools at our disposal that were developed in record time thanks to incredible endeavors in science and technology within the medical front. And we're continuing to learn constantly. I thought to myself, looking at it now, and Steve, you just referenced this when you mentioned trying to buy new vehicles so difficult. Really anything that requires microprocessors they're running shortages, and there's priority being given obviously to electronic devices as the world is so reliant on these things right now. But it is astonishing. Who knew that at the beginning of this pandemic, instead of hoarding toilet paper, we should have been investing in infrastructure and production of microprocessors? Now we know. Can't build cars with toilet paper. Okay, so folks, let's roll through here. Pandemic survival action plan, prep, plan, and stress less. So multi-step action plan, I look at it as three different things. What am I going to do for prevention as the number one thing? What's my plan if I do contract COVID? And third, how will I attend to my mental emotional health while living through a pandemic? The first two lines we've come to understand, the general public has come to understand, as many of us have either had COVID or helped loved ones, family members, and friends through COVID. We've learned a lot. In fact, we've all got a little bit of that amateur PhD in COVID right now. What is our plan if we contract COVID? This is widely variable depending on your health status going into it, and also unknown factors. I mean, the incredible variability in terms of how our human bodies respond to COVID is one of the most perplexing things when it comes to how to treat this. Because one can think my health status is particularly high, I won't be affected. And while high health status is a strong asset in our favor, it's no guarantee. We've seen very healthy people fall ill, and folks with less than optimal health get by unscathed. So there are a lot of questions that are still being answered here. But the third item is where I want to focus most of our energy today. And this is, how will I attend to my mental and emotional health while living through this pandemic? It goes without saying that this has been highly impactful for everyone, and for different reasons. Some individuals have had their businesses end over this, or a drastic change in terms of operation. Others have done fine or even benefited during this time and had more of the challenge be on interpersonal relations and being able to engage in normal social activity, and then every combination in between. So how are we going to attend to that mental emotional health component while living through the pandemic? So first part, prevention and or fortification, taking precautions to avoid contracting the virus. I know we all know this, but just in the interest of completeness, distancing and masking. Between those two things, the distancing component is the lifesaver, quite literally. Masking will be debated on a regular basis for some time, but I will tell you there's zero question within the medical community. Masking is far from perfect, but when we have to mix in environments where there will be other people, masks attenuate the spread. It's not a perfect solution. Distancing actually is, but we can't distance all the time. So distance and masking, as we know, have been chief tools through this. And then we have strengthening the system to improve our odds. So the vaccine brings up a big question for a lot of people, but many individuals have been vaccinated safely. We've got a variety of different vaccines to choose from, and talking with your medical professionals to go through the pros and cons. It is a healthcare decision. So of course there are pros and cons to taking it, but we've seen these vaccines be incredibly safe and effective at reducing mortality for the individual who does come into contact. So lots of questions around whether or not it attenuates spread much, and we're still learning. I mean, the true question mark, large question mark still exists there, but it does decrease mortality. Folks are not filling up the ICUs and passing from COVID who have been vaccinated. And then I put systemic support. What I mean by that is immune system support, but it goes beyond just the immune system. What you'll see I'm going to highlight shortly is there's a vascular component to this. And so systemic support for both your immune system and then for the vasculature, which touches every cell in the body. Okay, part 2 of the action plan, what if we get sick? So I've got URTI up there. That's an acronym that means upper respiratory tract infection. So upper respiratory tract infection signs right now are considered, they're guilty until proven innocent, right? So we don't want to shrug things off and say, oh, it's allergy season in St. Louis, which it is. But we want to take those precautions and rapid testing and or PCR testing to verify that you're safe or have the knowledge of your status if you have come into contact with or contracted COVID. So upper respiratory tract infections with signs including loss or taste of smell. And then for some individuals, that does not occur at all. For a percentage of individuals, seems to be somewhere around 20%, gastrointestinal signs predominate. Okay, so that's a particularly peculiar thing whenever that is what predominates, but it most certainly can happen. It has to do with the fact that mucosal membranes exist within the respiratory tract and digestive tract, and the viruses setting up shop in our cells. So we seek our medical guidance here and support. Go to your provider, trusted provider, and most individuals are able to weather the storm at home. Those with vulnerable systems may require intensive monitoring. I have a patient who's undergoing an incredible challenge right now with a major health concern, and Barnes saved her life. She spent 2 weeks there. I talked with her yesterday. She's home, healthy and recovered, but this would not have been able to happen at home. Immunotherapy is necessary for those vulnerable individuals. It saved her life. Take precautions to avoid spreading the virus. And just another point back there with, for example, my patient who was able to have a hospital bed to go to. This is the reason why we're taking such a societal initiative to try to not overburden the medical system. In the instances where individuals have needed care and been unable to be placed, we lose valuable time. We lose that valuable time. So this truly is a societal endeavor. So take precautions to avoid spreading the virus. Once you have it, isolation is the key. And I have many families that I take care of, instances I know of, anecdotal facts, but nonetheless in number now, where one individual in the household fell ill with COVID, was able to isolate in the bedroom or the basement. They were pushing stuff through the door for them, but there was no mixing in terms of food and stuff, but there was no mixing. And that one family member did not contaminate the rest of the household. So this isn't, this isolation works, distancing works. Support your system and improve your odds and resiliency. So involve your healthcare team. It's highly customized. There's no one size fits all. Again, systemic and immune support. And the third part, attending to mental emotional health while living through the pandemic. Let's face it, folks, this is rough business. We're all vulnerable to and have certainly endured stressors and upending of our lives, including this wonderful group that we're meeting with this morning. I miss seeing all of you in person. Our in-person meetings were phenomenal. I'm so grateful for technology and us being able to continue this, but completely upending our lives. So when we look at mental emotional health strategies, we got to get informed, stay informed, but limit the intake of media. Get informed and then get out. Don't overburden your system. A 24-hour news cycle and challenging information that is constantly coming in can overwhelm us in a way that make us less effective in our lives and less able to enjoy the good things. Maintain social connections and being able to have those connections. Again, thank goodness for technology. Thank goodness for outdoor activities and the fact if we're here in Missouri and in St. Louis, we have some of the best outdoor spaces anywhere in the nation. So taking advantage of the Missouri conservation spaces and our incredible parks like Forest Park, Tower Grove, and Babbler, places like that. And then the last part, release judgment in favor of personal relationships. I've gotten caught up with it within family dynamics, and I've seen it on social media, but thus attacking one another over differences, and sometimes over small differences that end up proving to be insignificant in the long run, degrade our mental emotional health, impact our stress response availability and our immune system. So releasing judgment in favor of personal relationships. So just to review here, 3 elements of personal wellness are physical, mental, emotional, and spiritual. 4 pillars of wellness include nutrition, exercise, restorative sleep, and mental well-being practices. So how do we pull these 2 things together? The 3 elements, physical, mental, emotional, and spiritual, and then our nutrition, exercise, restorative sleep, and mental well-being practices. Well, first and foremost, a well-balanced, nutrient-dense diet. Incredibly important. And we have many slideshows in the past where I've covered these details, but phytochemicals are where it's at. I want you taking in fruits and vegetables. The richer the colors, the more phytonutrients are there. And these are immune boosting and fortifying entities. And then daily practice of movement and exercise, walking, yoga, biking, swimming, dance. In other words, let's get moving and keep moving. Find something that you can commit to on a regular basis. Swimming is a great one. Here's an article that supports that. This is a peer-reviewed journal article that demonstrated a reduction in movement. This was individuals 70, 72, and 73 years of age. They took and reduced their step count for 14 days, and they measured a small but measurable reduction in muscle tone. But what was very, very impactful was muscle protein synthesis, is what MPS stands for, was reduced substantially. Insulin sensitivity went in the wrong direction. So sensitivity was reduced. We want high insulin sensitivity, and systemic inflammatory markers raised. So again, this is just 2 weeks of decreased activity. More reason why, even when things get tough and we have to lock things down for a little while, we got to be outside and moving. Mental, emotional support, stress support. So societal connectedness, and individuals finding a supplement program that includes adaptogens. You've heard me talk about this before, and we do have a whole slideshow up where I go over adaptogens and systemic support there. So I'll just review those things in a moment. This is a psychiatry journal talking about the impact of COVID, and they say in their conclusion, COVID-19 pandemic is exceptional in its impact. Its effects will be imprinted on each individual involved, and extensive stressors emerge or become worsened. Talks about stress on the medical staff, having to work on people, but children and folks living through this. It's incredible, measurable, and reported in peer-reviewed journals. Again, just a brief review, Adaptogenic Supplements. You can revisit this if you need to on, and then the other presentations where I cover these things again are up on E4E. So rhodiola, ashwagandha, and ginseng are all examples of adaptogenic supplements, and adaptogens help us respond to stressors in a favorable way. It builds resiliency, and they're very gentle. Talk to your healthcare provider about those. Care of the immune system, control for stress as best you can. Control for the factors that are controllable. Optimize sleep and exercise, eat for immune function, and limit challenges to wellness balance. So limit excess alcohol, limit sugar, and for goodness sakes, if you smoke, stop. Vitamin supplements, a high quality multivitamin, zinc, vitamin C, and B multivitamin that is a stress formula that's just specifically a B vitamin multi is very, very helpful. Not one size fits all. Ask for professional guidance here. This is something I just want to highlight. This is a journal article from last year, and it speaks of COVID and the way COVID is particularly challenging because the effect on the vasculature is so profound. And what it goes into is vascular consequences are so far reaching because all of our tissue in our body is vascularized to an extent. Yeah, your tendons and connective tissue like that, they live nearby vascularized entities, but all of our internal organs, everything in the system has vasculature, and COVID is challenging to that. So it's not just immune support, it's supporting your cardiovascular system also. So important. Okay, back to it. Mental, emotional, limit the intake of media, release judgment in favor of personal connections, and then, my favorite, meditate. Think of social support factors, staying connected to one another through family, friends, and gatherings, safe gatherings, and virtual gatherings. Mindfulness, so think of prayer, meditation, mindful walking, mindful eating, the bottom line is eliminate distractions so that you can focus on what's before you and have gratitude. Self-compassion. These are challenging times. Cut yourself some slack and get out and spend some time in nature. A little bit of time outside every day is very grounding. Look at that. Gorgeous. Spiritual connection, connecting to something bigger than oneself. So prayerful connection to a higher power, extending love and gratitude to others in the world, and getting connected with our faith. So incredibly important right now. So 3 things to start immediately. Minimize refined sugar intake, get enough sleep, incorporate mindfulness. Can you tell I got the same messages we're cycling through here? Plan on unplugging from technology with regularity. Engage in prayer and meditation. Again, just unplug and reset. And like somebody said earlier, unplug that computer for long enough that things can reset. The same thing is true for us. We need to unplug long enough that it's meaningful. So leave that phone at home when you go for the walk. Here's a wonderful writing done by a Hopi Indian chief. The Hopi Native Americans live in Arizona, and it is a culture known for their peacefulness and cooperative nature. So here is Chief White Eagle last year. This moment that humanity is living through can be considered a door or a hole. The decision to fall into the hole or go through the door is yours. If you consume information 24 hours a day with negative energy, constantly nervous, with pessimism, you'll fall into the hole. But if you take the opportunity to look at yourself, to rethink life and death, and to take care of yourself and others, you'll go through the door. Take care of your home, take care of your body, connect with your spiritual home. When you take care of yourself, you take care of others at the same time. Do not underestimate the spiritual dimension of this crisis. Adopt the perspective of an eagle that sees everything from above with broader vision. There is a social demand in this crisis, but also a spiritual demand. The two go hand in hand. And without the societal dimension, we fall into fanaticism. Without spiritual dimension, into pessimism and futility. This is what you can do. Find serenity in the storm, keep calm and meditate daily. Make a habit of encountering the sacred every day and demonstrate resilience through art, joy, trust, and love. Stay vital, stay vibrant, stay well, and stay fortified. Thank you, everyone.